London Health Sciences Centre is rethinking the way it completes routine low-risk surgeries in healthy patients. The hospital is opening up a new $7 million surgical centre across the street from Victoria Hospital that'll handle surgeries including bunion removals and knee scopes. By planning ahead and putting these surgeries in one spot, the hospital estimates it'll save about 60 cents on the dollar instead of doing these routine surgeries in big hospital operating rooms.
So essentially what we did is we grouped all the surgeons within a certain discipline, and we looked at all of the instruments that are in the operating room that are on the table when they operate, and we said we essentially want you to touch each one that's essential to the surgery that you actually use, and you can do time studies, you can do analysis on what's actually used. The truth is there's nearly 100 instruments put on the table, but just over 20 are used. We set up an OR on the main campus. We agreed to all the instruments. We agreed to the standards we required for the patients, anesthesia, nursing, and surgery. And we ran this hundreds of times. It's almost been over 2 years now. We track the turnover time. We track whether patients are coming back to the emerge. We track the satisfaction of the staff. We track any complication, and we compare them to the standard and see how we're doing. And on almost every indicator, we're able to beat it. So we're confident with statistical accuracy on the data that by moving these cases over, we would be safe in their delivery, that we would meet the standard of care, and that we would be able to do it just as well here as we are doing in the main OR. With the caveat is that those are pre-selected cases with well-trained surgical teams. In a sense, this design is based on giving the patient the resources that they require for that surgery. If you look at the OR as one grid, designing it all the same, that means each patient is given the same resources. So in fact, a large cardiac surgery is treated the same as a bunion surgery or a knee scope. But the truth is that would lead to relative waste because a patient doesn't necessarily need all the resources that are given to them. But that's the historical legacy of how the operating room functions, and that's the way we deliver care. When the surgeon books the room here, they would try to standardize and optimize all of their surgical cases to be the same, meaning they would be relatively healthy patients. We categorize patients on a certain scale. They would be healthy patients, and let's say it was knee surgery, it would be 6 knee surgeries in a row of the same surgery. So it's a little more work on the surgeon, and that the surgeon has to prepare and prep all the cases, all to be the same case, to be done in the room, which helps gain the efficiency. Our numbers showed in all of our microcosting of 56% savings as compared. So running in an efficient lean OR compared to a standard OR, you save 56%. And that's because, as I said before, it's not that the main OR is inefficient, it's that the main OR is designed to do everything. So if you second out the smaller surgeries, you're able to save more money.